Oh gosh, I'd say this set us back decades, quite frankly. Our hospitals, when they're submitting prescriptions or accessing patient data, it's an electronic system that houses all of that, and had a cyber attack on it and was shut down.
And it's been almost a month now that cyber attack has shut down access for providers and pharmacists. Change Healthcare is a popular system hospitals and clinics use to electronically bill insurance companies and what some drugstores use to fill prescriptions. Not every hospital or clinic uses it, but a lot do, and many in Idaho, which has caused a lot of healthcare providers to go unpaid, at least temporarily, because private and government insurance payments are being delayed weeks, having to now file them the old-fashioned way with pen and paper. Some systems employ thousands of people, and maybe they can shift some staff to kind of pick up the slack of this cyber hack. But the Idaho Hospital Association says it's mostly hurting rural hospitals because, well, they don't have the deep pockets to weather a storm like this. And what about smaller independent providers? Andrew Bartline talked to one of them who told him they feel like they've been stranded.
From the outside of a Meridian-based practice, notifications mean money.
Molly and Me Counseling. This is Hillary. How can I help you?
But dollars have never been the bottom line.
Can I start with your child's first and last name?
To the why behind the business.
To help children process feelings and emotions.
Or rather, these days, help yourself.
Manage my own mental health by not letting myself stress out.
A new piece of the puzzle to Molly Grattan.
Golly, I don't want to think about that.
The call you don't want.
I didn't even know about what had happened, and my biller contacted me and said, we have a problem.
A cyber attack shut down Change Healthcare, a popular billing system between healthcare providers and insurance. Greg Morson's with the Idaho Hospital Association. It's been a month.
I don't know that it gets easier with time, but we're learning more and being able to adapt.
But for an independent practice, it's an even tougher call to make.
All of a sudden, we're 2 weeks into this crisis, and I look at my bank statement and think, okay, next week's payroll, we're going to be dipping way down in our account.
Without payment from insurance, Molly's only collecting copay and surviving off a significant loss of revenue.
85%.
Talk about budget cuts.
Medicaid, we don't collect any money from the consumer. We have to wait for that reimbursement from the state. And so when this happened, we were receiving absolutely no money.
And she's one of the lucky ones.
I run my business in a way that maintains good cash flow from month to month. I was terrified for other people. I have friends that are out in private practice and run other businesses, and I worry for them because this is a serious issue.
In a matter of national security, the cyber attackers don't want money. They just want to cause problems. Most commonly, that's an attack from a foreign government.
There's no standard how long it lasts. It just depends on the scope and breadth of the attack.
And the scope of the impact could be right in your neighborhood.
We actually have a referral list at this time.
Where office small talk is all about how to stay on the line.
And maybe there's a part of me that's been living the last couple of weeks burying my head a little bit in the sand, knowing, okay, we're good for a little bit, but a couple of months, and then I'd have to be making some serious decisions.
Molly says Change Healthcare is now running tests to practice those electronic payments. She says it feels like there is hope on the horizon, but there's not a lot of concrete details on that, and it's not necessarily that the money's lost forever. You kind of alluded to it earlier. They'll get paid out eventually, but at what point? Is that going to be April, May, June? Is it next week? They'd prefer that. And so, like you said, those rural hospitals don't have the deep pockets. Well, those independent practices certainly don't either.
Are they getting any buffer from any of these insurance providers?
I know that it was either Medicaid or Medicare, from what we heard from IHA last week, that they're trying to do some payments up front to help people out, some like no interest loans.
Yeah.
For the private insurance, I imagine case by case.
I mean, we kind of did something similar during the pandemic. I can see why that might apply to this situation. All right, thank you very much, Andrew.